Over the past few months, our country has stood together to keep the COVID numbers down. The numbers are important because they decide how the story unfolds. At Safaricom, our numbers also tell a story of hope, resilience and recovery. Every day, new numbers tell us the same story, that we never let what we can't do come in the way of what we can. Let's keep going.
Indeed, we have a long journey with the healthcare providers in this county. Everybody is a shareholder in that success of Nakuru. I am happy that there has been progressive improvement in healthcare.
And we believe in the next 2 or 3 years, there will be no reason whatsoever for anybody to go beyond our borders to seek any form of medical treatment, because we have invested sufficiently and trained our people, our doctors for that matter, to make sure that we are moving on well.
I believe Nakuru can reverse and become a destination for medical tourism.
Hello, Nyandarua County, Nakuru County, level 5 hospital. Cost 100 million. Gilgil maternity cost 40 million. Gilgil maternity. Olenguruoni sub-county hospital. Donation is 100 million outpatient. Greetings, wherever you're watching us from, and welcome to Between the Lines. I am your host, Karanja Jackson. Home-based care services is what is on my clipboard today, and we sit down together with two distinguished ladies who are doing something in helping address this issue, the COVID-19 pandemic in our republic. To my close left, I have Mrs. Ellen Ngware.
Yeah.
She is the County Health Promotion Officer in Nakuru County.
Yes.
Welcome to the show.
Thank you, Karanja.
Then to my extreme left, I have Madam Jane Josiah. She is the Programs Manager, Midriff Hearing Aid. Welcome to the show.
Thank you, Mr. Karanja.
So, Madam Ellen, maybe you could tell us what it is that you do.
Thank you, and I will request my viewers together with Karanja to allow me remove my mask and remove it in the light way, because at least we have kept social distance. So my name is, as Karanja has said, I'm Ellen Ngware. I coordinate health promotion activities in the county under the leadership of our CEC, Dr. Kariuki Gishoke. So I coordinate one of the program, Health is Diverse. So we have program officers, and I coordinate one of the programs. And the health promotion deals with educating the community or empowering the community to own their own health by giving them information about health, so that they can understand health, and when they understand health, then they can be responsible to take care of their own health, thus reducing the disease burden in our county. So I coordinate in the 11 sub-counties in the county, but now I stay in the county office, but I have officers in all the 11 sub-counties, so I coordinate them so that we can be able to reach out to the community, promoting the community to stay healthy. So things dealing with awareness, for example, when we have activities like right now, we have had vehicles going around telling people about the prevention of COVID-19. We have had people going to households reaching out to educating the community about hand washing, wearing of the masks, social distance, so we make them understand what do we mean when we tell you to wear the mask. How do you wear the mask? Why do you need to wear the mask? Other than just telling them wear the mask, keep the social distance, they need more. Why do they need to keep the 1.5 meters? They need to understand, and when they understand this, then they embrace it. So I do this all out together with my other colleagues to empower the community to own their own health.
And we will be coming back to that because we've been witnessing some complacency in regards to these measures. Madam Jane, you are the programs manager at Midriff Hearing Aid.
Yes.
Would you mind telling us something about it?
Yes. Personally, I'm the one in charge of a program called rehabilitation. But as Midriff, Midriff is a big organization. Actually, it is a non-governmental organization. It is based here in Nakuru, and it was founded way back in 2008. Mainly, we are here to be able to empower the citizens, the state actors and the non-state actors to be able to inculcate the human rights approaches in their programming. That is as Midriff. Within Midriff, we have different programs, and I manage one of the programs, the program that is hosting this show today, this talk show today. In rehabilitation program, we aim at improving or increasing the access to mental health and psychosocial support to the communities. We are, yes, based in Nakuru, but we have not been able to meet, to be able to spread to all the counties, sub-counties rather, within Nakuru. We are mainly in informal settlements, that is in Karagita, in Naivasha, in Ronda, Kaptemba, and right now we have started entering the Bondeni informal settlement, whereby we are trying now to promote uptake of the psychosocial services to the community. And during this time, we had COVID, during the pandemic period, we are having a lot of activities to do with awareness, to do with the promotion of health, to be able to sensitize the community on what is happening in the, what can happen to them because of the pandemic and what they need to do. And we are doing this in partnership with many other stakeholders because we are not able to do this alone. One of our partners is the County Government of Nakuru, Department of Health, with whom we have an MOU for doing this work. Actually, we were on course to providing mental health services actually psychosocial services, but with the pandemic we had to reprogram, but still we are in the field or in site doing a lot for the community. Yes.
And we shall be discussing that as the show continues on the different approaches and the measures that Midrift is taking in helping help these people that are affected by COVID.
Yes.
Let me come back to you, Madam Ellen.
Yes.
We are witnessing a surge in the number of cases, especially here in Nakuru.
Yeah.
Right now, the number stands at 227 cases. We do have 61 recoveries, yet, but we do have 5 people that have succumbed to the disease.
Yeah.
What do you think now in your practice, as you go down to the Mwananchi and to the local places? What do you think is contributing to these rising numbers?
I think what is contributing to this, for one, when the president opened up the country, people were like, they were in jail somewhere and then they have been released. So people were like, we want to go back to our businesses. We want to move from Nairobi to Nakuru, from Kisumu to wherever. And we realized that as much as we are getting those people who are coming with symptoms of the disease, there are those people who are harboring the virus, but they are asymptomatic, meaning somebody is having the virus or the disease, but he cannot show any sign or symptom. So this person is continuing with his own duties here and there, or traveling here and there. But remember, this person can still transmit the virus from one person to another. So we associate this with the movement of people. The other thing, when COVID came to us, when we had the first case in the country, people thought this disease will be short-lived. So I remember when we started doing awareness, people embraced it very well. They could wash their hands, they could keep the social distance. By then we had not even started wearing the masks. And people were so responsible to do this. But when now the time lengthened to 1 month, 2 months, 3 months, now we are getting to 5 months. It's like people are coming back to early lapse. And actually, when we have gone out there, even in the community, you hear people, they're saying like, it's like this disease is not there. I've not seen a neighbor who has been infected. I've not seen a relative who has been infected. So it's like people are relapsing and seeing like it's a disease of there. It's like the government is playing a game, and people have relapsed. And through this, we have gone back to doing something we are calling behavior change. We want to call on people. We are hearing the numbers daily. People are dying daily, like Nakuru, as you have said. We have already have had 5 deaths. You may not be knowing one of these, but the reality is the numbers are not fake. People have died. We have already people in our isolation centers who are being treated. We have numbers above 200 people that are sick, 227 by yesterday. People that are sick. This is reality. We have seen all over the country. So we want to plead with our community, and that is why actually we appreciate when we have platforms like this, that our community can hear. We need behavior change. When we talk about wearing the mask, and we have talked to the community, we have told them it is very possible to protect yourself against COVID-19 by simply wearing your mask and wearing it in the right way. It is very possible for you to prevent it. I can be in contact with somebody who has COVID-19. We can be able to interact with this person. But so long as I will have taken the measures, wearing the mask, washing my hands after we are together immediately or many times, and even keeping the social distance, I can be able to protect myself from the disease. And the moment I protect myself, I protect my family, I protect my neighbor, I protect all the Kenyans. So we are pleading with the community, because it's like people have relapsed because of the length of time. And then the other thing is like the disease is getting with us longer, because the numbers are growing high day by day. And as we started saying from the beginning, when one person is infected, this person has a capacity to infect 2 or 3. So the more numbers we get, the more numbers are going to grow. Because like now the 227, though I appreciate in the 227, there are also the recoveries about 60 that have recovered from that. So the 100 and something that is remaining, this person, if he can be able make a touch of the mtungi, it is empty. And ask a question, imeisha, muda kidogo imepita. But look around there is no sign of somebody who was washing his hands. There is no trickle of water around there. So we want to call on our community for a few things. Self-responsibility. And when you are responsible to protect yourself, to do the things that you are expected to do as an individual, you will protect yourself, protect the community, protect the family, and we shall be there. Otherwise, if people continue the way they are continuing, things are going to be worse. As the Department of Health, we have tried. Right now, we are trickling down to the communities. I know our leader, the CEC, was here some time back, and he narrated a lot about the same. We have trained community health volunteers who will help us as the health care providers to reach out to the households. By ourselves, we may not, but through the support of our partners, we have been able to train health volunteers. And these are people that we have drawn from the community. The people that our chiefs helped them to get them, helped us to get them from their communities. Just from the Nyumba Kumi, we get a few from there. So that, and we have empowered them with information so that they can go to the household level, checking, are you keeping the deliberations that we have been told by the Department of Health together with our government? Do you have the hand washing facilities? And through that, we are looking forward to achieving what we needed to achieve. Otherwise, it's a challenge that the numbers are rising day by day. We are, as the Department of Health, we are doing the much that we can. But if our community is going to stay in the status they are in, we're calling it the status quo, that they have relaxed, they don't want to, they will wear the mask when they see the police. That one will not be right. So we have tried our best to reach out to them, to give them information, and as the Department of Health, we are optimistic. If they are going to embrace the information we are going to give, we are giving them, we shall be able to combat the disease. But right now, things are not so nice.
We will come back to you, and we will discuss a little bit more on what this raising awareness, is it fruitful or not? But we'll be coming back to it.
Thank you.
Madam Jane,
Yes.
you lead a program that is involved in our discussion today on home-based care.
Yes.
Please share some light on it.
Okay, about the rehabilitation program, actually we are working with the county government of Nakuru, and our work as an NGO is to augment the efforts of the government to give the services to the community. So we are trying also to fill the gaps where there are gaps, like Madam Helen alluded a while ago, that the government cannot be able to do or provide these services on their own. The community health volunteers, who are the frontline workers, who are the level 1, actually required some empowerment to be able to respond to the issues that were arising as a result of COVID-19. Remember when the outbreak just emerged in Kenya, we had people who are actually full of fear, people who are depressed, people who are confused, people did not have information. There were a lot of myths and misconceptions and a lot of misinformation about COVID-19, and nobody knew where to start. So Midrift was there in the community with the rehabilitation program. Already we were doing what we call the PM Plus, that is the problem management, which is a module by the World Health Organization, which helps the communities in adversity to be able to cope with the problems. And we were able now to reprogram or to remodel or to use even another approach, that is the psychological first aid component of the psychosocial support, to be able to provide the PFA or the psychological first aid to the community. So we trained the community health volunteers within our project sites so that they can be able to provide these services to the community. Because psychosocial support basically is just a set of actions that helps the client or the person who is in adversity to be able now to cope with the situation. You listen to the person, you look around what is happening, you link the person for support, you also provide the support that you can be able to provide. And that is what the program is doing right now.
Would you share some light on maybe the different regions that your organization has been working in?
Yeah, as I said before, we have as Midrift, we are working in the entire of Nakuru West, Nakuru East, and Naivasha, Baringo, and Kisumu. Although we have had a slow maybe uptake of the, initiation of the programs in Baringo and Kisumu because of the COVID. So, but post-COVID, we are very sure we are going to hit the ground those areas. But within Nakuru, as rehabilitation program. We are very strong in Nakuru West and in Naivasha, particularly in Karagita, and right now we have begun the program in Bondeni, informal settlements. Yes.
For those who are joining us, it's another edition of Between the Lines. Today we are discussing home-based care services for COVID-19 patients. And in studio today we have the County Health Promotion Officer, Madam Ellen Guarem. Alongside her is the Programs Manager of Midrift Hurinet. Please keep sending in your questions, your suggestions and comments. We shall sample them as the show continues. Let me come back to you, to Madam Ellen. What is home-based care?
When we talk about home-based care, it is taking care of clients who are asymptomatic. And when we say asymptomatic, this is a person who has already contracted the virus, but cannot show any signs of or symptoms. And now we are doing targeted testing, and that is how we are capturing these people. Like we are doing it for the health workers and the long-distance truck drivers. So we get these people, and when we come to test them, actually somebody will just come as a routine. But in the process of testing this person, you realize that this person has the virus. And when we get these people, so when we talk about home-based care, it is where, because of the numbers that we're having, we are not able to put all these people in isolation. And this person has come to us, his health is okay, but he has the virus. So what we need to give this person is to support this person and to continue observing this person, that he doesn't get to the stage of the disease deteriorating. So this person has the disease, but he's not showing any signs and symptoms. So when we talk about home-based care, we want to take care of them at home as we observe them to recover from the virus, because as much as they are not they are asymptomatic, we shall take care of them, continue to observe them. There are those who may convert and become sick. They may deteriorate. There are those out of the care that you're going to give them, because mostly we are advising them on diet, to take the proper diet. If his immunity is okay, there are some that are recovered very well. So when we talk about home-based care, is where we keep them either in their setup and take care of them there at home. But before we get to this, as the Department of Health, we are doing an assessment. It is not every home that qualifies to be a base for a home-based care for any patient. So when we get a particular patient and he needs home-based care, and possibly we talk to him because of their psychological support, we also want to ask them, is your home okay if you're going to keep you at home? Then when he will admit that he needs to be put at home, as the Department of Health, we need to go and assess that home, whether it meets the criteria of this person being undertaken through home-based care. We have guidelines and policies that are guiding us through the WHO on the setup of which we can put somebody in a home-based care. So it is simply taking care of a patient who is harboring the virus in his home environment or in a place where it's set apart for him. So when we meet home-based care, is it in his compound? If it is in his compound and we have assessed the place and it meets the criteria, then we put him there. Then we say he's being taken care of in a home-based care. So it is simply taking care of a person who is already having the virus or it is positive of COVID-19, but we are taking care of him at his home setup.
And I'm glad that you've mentioned we are getting a lot of feedback from our different platforms. I just want to throw this first question to you from Otieno Monsi Mata, and it says, "Hi, I'm Mandela. I have a question for Madam Jane. How does a patient who lives in a single-room house with a family of 4 manage the home-based care without infecting other members of his family?"
Thank you so much, Mandela. It is not every home that qualifies to be a home-based care. And that is why I said, when we get you and you're positive, and we ask you whether you would admit to get home-based care, because the government and the Department of Health, we are also having facilities where we are putting people up for home-based care or for care. Let me call it for care, because that one may not qualify to be a home-based care, but it is a setup where we are putting you for care. So when we get you and you allude that you're going to you can be comfortable to be taken through home-based care, we take history, we assess you. How is your home? Is there room? Is the room enough? What are the kind of people? For example, the things that we are assessing is the space. The moment you get you positive and you want to be taken at home, is there space? So if there is no space, you don't qualify. For example, he's talking about a single room and you're having your 4 people or you're having your family, that one does not qualify. But if you have a big house and possibly a room that is set apart aside, we can go and assess the home and we can see that room, somebody can be put there. The room can be there, but does it have ventilation? Do they have sanitation facilities? For example, will you continue sharing the bathrooms? Will you continue sharing the toilets? Or is there a toilet or a bathroom where we can give this person? Because we don't want to extend now the infection to the other people. So we assess the home. So I want to say it is not everybody who qualifies to be taken through home-based care in his setup. We have to assess and see. And there are people whom will say, as much as our facilities will be full, we shall have to look for a place where we can put a particular people because their home does not qualify to be a home-based care. So it is not everybody who qualifies. There are all those criteria. We are also saying there are also vulnerable people. The people that are above 60 years, the elderly, they are vulnerable. There are people, the children also that are below 5 years, they are vulnerable. If there are women that are expectant, a person that is living with comorbidity, when we talk about comorbidity, is these long-term illnesses like HIV, AIDS, there is diabetes, there is hypertension. If you are living with such a person in your home, it may not qualify to be a home-based care because we don't want to compromise the other people. So it is not all setups that qualify for a person to be taken through home-based care. We have to do an assessment.
Another question before we take a breather, it's to you, Madam Jane. What criteria do you take when you're getting survivors to support?
Oh, that's a very good question. I would say, first of all, that different people react differently to adversities. It will depend on the circumstances in which you are and which support you need. Once we identify maybe that you need psychosocial support, that is mental support, then we can be able to support you mentally. If you need maybe treatment, some people are sick, we send you or we refer you for treatment. If you need maybe counseling, just counseling, we send you to that person. I would say that there is no uniform way of dealing with clients. We listen to whatever situation you're in or whatever you're going through, and then we are able to explore the issues, and then we are able to explore also the solutions together with the clients. But generally, if you need to support somebody probably with a livelihood or a food basket for that matter, there are some criteria that you can use. You can be able to look at the income levels of the person, you can be able to look at the household, the way it is, and you can be able to assess whether that family actually requires food or it requires any other support. Otherwise, there is no uniform way of handling clients. Yes.
Thank you very much. We will take a small breather. It is Between the Lines, and today we are discussing home-based care services for COVID-19 patients powered by Midriff Hurinote. We will be right back. Welcome back. It's another edition of Between the Lines. Today we are discussing home-based care services for COVID-19 patients. I can still see a lot of your comments and feedback. I want to salute Eric Kibari, Kezo Cole Kid, Simon Mwangi watching all the way from Nairobi, Calvin Munga, Prince Charles Mwangi, Mildred Mwai from Kisumu, Otieno Monsimata, who was asking the question about the home-based care. And actually he has another question for Madam Ngware. What is the county government doing in curbing the rising cases in Nakuru County and the upward trend of the COVID-19 in Nakuru as a whole?
Thank you, Otieno. Is it Otieno?
Yes.
Thank you so much, Otieno. I want to assure you that the county government of Nakuru, through our leadership of Governor Lee Kenyajui and the health fraternity, we are doing our best. And the best that we can do right now is to call on the on the community to embrace behavior change, because we have done our best. If you go around our county, we have put the hand washing facilities. The government is also providing masks. And the much that we can do and the much that we are doing is to ensure that we continue empowering our community. We tried to disorganize the town to make sure that there is social distancing. And right now, if you go out, you'll meet our officers are out there on the ground, trying to empower the community, trying to find out what is that we can be able to do again to help our people and to hear what people need from us. Because what we have realized is just the relapse. The relapse and with the relapse, things are not going to be good. But the county government of Nakuru, we are doing our best. Right now, you realize we have put measures even in our hospitals where people are going because we have realized one of the sources of infection. We are not allowing the visitors to come to our hospitals because we want to reduce the burden of infection. So the county government of Nakuru have done its best to reach out to the community. People are staying at home. The other thing that is causing people also to come out of their homes is that people are not having food. And the government, not necessarily the Department of Health, but the county government, we have started dishing out foods to people through the GAO. The GAO is the administration department from Nairobi. So our chiefs and our DCCs are out there in the community in conjunction with us to make sure that we are looking for food for those people who are enclosed in their homes, to make sure that they stay home. If they don't need to go out of their homes, they can stay home, but we ensure that they have home. We have a team, the response team, that is also comprising of the psychosocial support group, where we go speaking to our people, giving them information, because as the time has continued to lengthen about the disease, people are worried. And because of the psychological and the mental issues that people are having, people are out there and it's like they just want to go out in the town and stray around. It's like the disease is not with us again. This is a thing of the government. This is a thing that is just being cooked. So as the Department of Health, the much that we are doing right now is to create awareness to our people, to let them embrace and accept that the disease is there. And when they accept that the disease is there, then take the preventive measures. Because if we continue doing it alone as the Department of Health and the community is not coming on board to take responsibility, then we shall not make it.
Now, speaking about the psychosocial support and the issue about the psychology, I want to throw this question to you, Jane. What are these psychosocial support that your organization is offering to people?
Okay, first of all, as I said earlier, when we initiated the program, we were trying to provide psychosocial support, I'll unpack that, to survivors of sexual and gender-based violence within Nakuru. And as it is, Midrift implements programs that are evidence-based. So we had a research, and we saw that there was a need for the same. After a lot of consultations also with the stakeholders, and also capping it with a baseline survey that we conducted sometimes last year. Maybe we shall be here to talk about that later. But psychosocial support is a set of activities that are undertaken or are provided as a service to an individual or a client who is in adversity and who needs to understand the situation he or she is in, so that they can be able to make a decision, or to be able to come back to their own senses, because it is like somebody in a crisis, and the person cannot be able to make decisions. The person does not know which actions to take, and even if they know how to take which actions to take, they may not be able immediately be able to undertake that alone. They may need some certain support. So it is not a professional service, but there is a procedure of providing a psychosocial support. And one of the approaches that we use at Midrift currently, because of the crisis, is what we are calling the PFA, or the psychological first aid. And as I said this earlier, immediately after the pandemic and the emergence of the pandemic, people were panicking and people were afraid of getting infected. People had a lot of worries. People were actually confused. Almost everybody.
Actually, some people even here in our office, in our studio, we closed and we went home.
Yes, everybody was fearing, and I would attribute to maybe part of our work especially in the slum areas or the informal settlement, to what we did. We were trying to educate the community, give them the facts, give them the right information, let them know what is this COVID, what is it, how it is transmitted, how it can be prevented. And people actually became relaxed, and we could see that people now are not so afraid of the disease. But unfortunately, maybe they have taken it too far and they've become relaxed, because they had not seen maybe deaths, or maybe they were not directly affected. And I would say it was good and it is bad, and people can use or misuse the information, if I am not wrong. And so right now, when you visit some of the households, they still are affected by COVID in many ways. Some of them lost income, some of them are facing gender-based violence, others are facing other forms of violence. We have seen cases of teenage pregnancies and all that, and some people do not have different kinds of support that can help them to cope at this time. So when you visit a client, or when you visit a household, and through the CHVs, that is the community health volunteers, and other trained persons in the community, you listen to the person. You are able to give the person a chance to tell them what they are feeling, to explain to them their fears, their worries, and whatever they are going through. And then you can explore with the person what is it that you can be able to do about the different situations that they are in, and then you help them to make a decision. Where you can be able to support, you support. For example, if you can be able to refer somebody for counseling, as I said earlier, if you can refer for a food basket, if it is about the food basket, if you can be able to go down with the client to help the client to manage stress using different strategies, it is very important, because the person is able to calm down and is able to make informed decisions, and is able to make maybe some steps towards alleviating or tackling the issue that is affecting him or her at that time. So that is the service we are providing to the community. Before we did this, we had to do a training for the community health volunteers. Actually, in Nakuru, no one else was doing that. I would even say even the county government was not doing that. Midrift was the first to do this, and we are grateful to our partners, that is Dignity, our Danish Institute Against Torture, who were able to provide us with manuals on the same, and also provide us with support for the same, and also the empowerment for the same, and we were able to cascade this down to the community health volunteers and to the community health extension workers within the areas where we work. And they started providing the services, and they're continuing to provide the same services. So there is work going on at the community, and we are we are very optimistic that this empowerment, or this capacity that has been done to our community health volunteers, is a resource that is going to remain in the community. So post COVID-19, or without even COVID-19, any other emergency that comes, we have a team of community health volunteers who can be able to handle any emergency, because now they are empowered. And we are asking the county government now to come up and support them, so that we do not duplicate the work that we are doing, but to support each other, because the resources are scarce, and yet we are serving the same community. We are also calling on other CSOs and other partners or actors. Let us do this together. Midrift may have done it in the sites where we work, like in Ronda, Karagita, and Bondeni, but there are so many other areas that need this support. We have 11 sub-counties in Nakuru, and many other areas that we need also to get our services to. Because of the resources, we can come back, we can come together. And because the community needs this service to do this. So we are looking for a way of working together with as many partners as possible to scale up whatever we are doing, because we are seeing that it is bringing a positive impact to the community. Yes.
And I think that's a rallying call that has been made on different platforms, that this is not a one-person fight. It should be a concerted effort
Yes.
in helping fight the pandemic. That for us.
A psychological first aid is just a simplification of psychosocial support, is one component of psychosocial support. Actually, what you do with first is just the response that you go to the person with somebody in advance. There is an emergency or a crisis. The first thing that you do is to go and listen to the person, as I said, and be able to look at what is affecting the person, whatever the person is going through. Can you be able to support this person, at least to be safe in the first place, and then to be able to get in control of their own emotions and maybe address their worries and their fears? Yes.
Allow me to go back to you, Madam Ellen.
Okay.
On the idea of creation of awareness, and as you have mentioned, that there is a surge in the numbers, and as Jane has mentioned, after people got the information, they again became complacent about it, and nowadays it's like we have dropped our guards, which again has necessitated maybe the members of the police to now start arresting people that are not wearing masks. We may discuss that because there's other ramifications to arresting people for not wearing masks. But do you think there is a better way in pushing even the members of only this county to observe these measures?
There's a better way, and actually that is what we are doing. Last week, but one, for 10 days, we trained health community volunteers. And the aim of training these people is that we could be able to reach people one-on-one through their households, because we have spoken to them in groups, we have reached them using all the social medias that we have tried to, but now we have these people who are their own. The health volunteers have been drawn from their own homes. So we are supporting them to go to households, to go and find out from this particular household, do you have masks, or why are you not wearing masks? Do you understand the disease is there? When they can be talked to one-on-one. Actually, that is now the main strategy that we are using right now, reaching people one-on-one to find out what could be the challenge that you're not able to wear your masks, what could be the challenge that you're not able to sustain that hand washing facility or to maintain the behavior of washing your hands. So the strategy that we're using right now is to try to reach out people one-on-one as we continue to support them, and that is why the other hand of the government is coming in. When they could it be that they don't have the masks, and actually they are coming to an extent that we are giving the volunteers the masks. If they go and are not able to wear the masks because the masks are not there, they can be able to provide the masks. If they're not able to wash their hands because they don't have the washing facilities, what can the government do to ensure that in a particular spot or in a particular household there are hand washing facilities? Such, okay, the only challenge that we have for the social distance, especially when you go to some setups like Bodeni and other setups, it is a challenge to us, and the government may not have a way out in that, but the much that we can do is to put down the measures that we are able to put. If they can be able to wash their hands and put the masks and stay home, if it is a household, if they can be able to stay home and the government provides food for them, the better. So the main strategy that we're using right now is to reach people one-on-one, and that is why you realize that we have many partners who have come on board, and they are helping us to be able to disseminate in every sub-county and in every ward that we have as many people who have been trained. We are, especially like next week, we are rolling down a strategy where we are going to reach out now to train the community leaders to bring their people. If it is the women leaders whom we have already trained, let them bring to us the women groups that we can speak to them. We are trickling down to the community because that is where the challenge is. So we are trying to reach people one-on-one because we have done it publicly. We have used all the social medias that can be able to use, and people have understood. But now we want to find out why or where is this problem coming from by reaching out to them one-on-one. What we are calling interpersonal communication. We want to get down there and reach them.
Jenny, you have something?
Yes, I'm saying as midriff we are trying trying really to reinforce that, because we are seeing the community health volunteers, they are able to even visit up to 30 households in a week, to be able to talk to them, actually providing psychosocial support, talking to them about all the issues, and exploring why they're not following adhering to the laid down measures for COVID-19 prevention, and also being able to support them. So we are trying to reinforce or to actually support the county government in doing that. Yes.
And I think kudos for such a great effort.
Yeah.
Let me come back to you, Madam Ellen. Let's go back to the home-based care home. Would you brief us on what exactly happens? You've gotten a patient, now you've put him under home-based care. What next?
When we get this person and we have found out that he's able to stay in that home-based care, the first thing that we do, we also take a moment to speak with the family members that are in the compound, because as much as we shall be coming in as the health care providers to take care of this person, they also need also to know, because this person needs to be fed. So we first of all talk to them about the diet and the care that this person needs, and then that person being a father or a son or a mother, he's secluded in a place by his own self. They also need our psychological support. So when that person is there, for us as the healthcare providers, we have to see this person daily and not even just one time, to ensure that we observe this person, because he already has the virus. So we want to find out, is he becoming well, or is he becoming worse? Because so long as he has the virus can still intimidate him to him getting worse. So by taking the observations of this, taking the temperature and ask him other questions, are you coughing? Are you okay? Do you have any problem? Ile maswali ya kawaida ya daktari. So we need to investigate this person daily to find out whether he's becoming better. And actually I wanted to appreciate and to report this, because it is in our database, that we have already had 51 patients who have been put on home-based care, and around 24 of them have already been discharged. They have been on home-based care. We have been visiting them and seeing how they are doing, observing them, and then after the 14 days we take their first test and their next test, and they are negative. So we have already discharged 24 of them who has become well through home-based care. The other 27 are still ongoing with their home-based care. So we want to appreciate. So our main work as the healthcare providers is to make sure that we visit this person daily, not just once, to make sure that we support him psychologically, to make sure that we investigate him, and we also observe him to ensure that he's doing well. And in case this person is in that setup and we observe that this person is becoming worse, he may need some support from a hospital setup. For example, if somebody gets worse and you may need to be put drips, intravenous, either drugs or water, or in the hospital, we may need to take you or to refer you from the home now to the hospital. And that is the essence of observing this person. We have a response team that also has a psychosocial support person, because this person being secluded there, the children are on this side, wanakupatilia chakula pahari, because we also advise them, when you cook food, you have to put the food in a place where this person takes the food and then takes back the utensils to the other side, if it is a person who cannot cook for himself. But if it is a person who is able to cook for himself, anatengewa vitu zake aweze kuzitumia mahali pale akiziosha, kwa sababu kama hauna ugonjwa, you are just asymptomatic, you are an okay person. If it is a mama or a papa who can cook for himself, we give him his things to prepare food for him there, for himself there, to eat there, and possibly what he can do if it is in the compound, to wave to the people and not to come near them. And that is what we are talking so much about, the psychosocial support, because it is torturing. And that is why I said, in the first place, we don't just push people to the home-based care. We have to let them accept. So the moment we get you and we need to take you to the home-based care, we have to talk to you. Do you feel you need to go to the home-based care? Do you have space? So before we assess the home, you accept and your people accept. There are those who will say, ni vizuri mumweke mahali fulani yaweze kupona pahali fulani. The government has also said some places where we can put such people, as we talked about, those people who are in the setups where their homes do not qualify for home-based care, or this person whose family has those people whom we talked about, the comorbidity, the children, the elderly, so he cannot qualify to be there. So the government the county government of Nakuru already has a setup where these people can be put. So as the Department of Health, hatukuweki pale halafu tunakuacha. We are working hand in hand with you every day with different teams visiting you, talking to you, giving you the services that you need to get in order for you to continue well. And that is why how we have come up with the 24 who have recovered. We tested them, and after they recover, we test them twice. Then we discharge them to go and join their families.
Allow me to come to you, Madam Jane. In our discussion so far, something is coming out clear that we do have people that are not very we may say pocket-wise. Hawana mfuko mzito. They are not able to support themselves. What is your organization doing to help such people that are poor or even vulnerable during these COVID times?
Okay, at this time, and I would say immediately, we have been trying to identify the very needy persons. We have a set criteria for identifying the very needy persons, as you call them, those people whose maybe pockets are empty, so that we can be able to support them with a food basket, which can be able to see them through for some months, actually. And I think I'll be here next week to talk about the same, because I have not yet launched the program. So yeah, we are going to do that. Meanwhile, even if it is not about the pocket, because for sustainability services, this person needs to look ahead. Go and establish, first of all, what is happening to this person. How was the person before COVID-19 set in, and what is it this person is thinking about moving forward, because the person cannot rely forever on relief food, as we would call it, or humanitarian aid. So by next week, we expect we are going to be supporting some families within the informal settlement with some food baskets to be able to help them to cope with the situation. Yeah, we have a selection criteria for that. Meanwhile, as Madam Ellen was talking about psychosocial support, we are seeing that as midriff, we need to do a lot of awareness, and we are already doing awareness from the beginning, because once these people have been put into maybe home-based care, there's a lot of stigma around there. So apart from people being told or community being informed about COVID-19 and about home-based care, there is the issue of stigma about self-care, because even if you are not affected, you can actually stigmatize the other person, and stigma has got its own effect. So a component of the awareness that midriff is also raising within the community is about addressing stigma. Let's not stigmatize those people who have been affected, or the families who have been affected, or even the survivors of COVID-19, because this will not bring about good health for the persons, especially mental health. Yes.
And now that you've mentioned, we have a response from one Andrew Muturi, and he's saying, my name is Muturi Gisheru. My question is on the issue of stigma surrounding the COVID-19. How is home-based care handling the stigmatization of potential and actually the real patients?
Yeah, I would ask my colleague to respond that.
I would say, I started by saying that we're not just pushing people to the home-based care. And actually, to us, home-based care is a good bridge to stigma. Because when people are taken to the isolation, there is all that isolation, and you are out of your family for those 14 days or for the long time that you're going to be in the hospital. But now, when you are in the home-based care, we have time to interact with you and to interact also with the family daily. And especially when we come and we have put you in a room alongside there, I say you are able to see your father, your mother, or your son daily when he's on that corner, rather than when he's in that hospital where we shall not even allow you to go and visit that person. So to us, home-based care is also acting as a way of breaking the stigma, because as much as you are secluded in a place out there, you are able to see your people daily. So to us, that is a thumbs up for the home-based care. Okay, the challenge is only if the home cannot allow. But a home-based care is one of the best ways to bridge the gap. Because after we go with you, for example, the 24 people that have already gone through home-based care in their setups, after we test you the first test and the second test, you just come from the other gate, from the other house to the other house, and join your family, of whom you have been seeing daily and possibly interacting from a distance. So to us, home-based care, if it would work in our county, the best, and it is already working, because we have already have a positive thing in this, where a group of people have got well. So we want to say home-based care is a bridge to to stigma. And that is why we are continuing empowering our community to accept that COVID-19 is with us. We remember in the 84s when HIV/AIDS came to our nation, it was like people didn't know what to do about it. Tutaweza. I remember even the barriers, people used to run away. Nowadays, you will never know. In the families we are living with our own who are having HIV, we have accepted it. We learned to live with it. We have supported our own. Actually, the trend of HIV is going down. And that is why we are calling on our people. If people would accept that COVID-19 is with us and know it's a flu like any other, it's only that it is so infectious, and know that it is a flu, and we take the measures to prevent the COVID-19, accept our people. I have seen people who have recovered from COVID-19 coming out to speak to people. They are trying to break the stigma and tell people anybody can be vulnerable to get COVID-19. So if we accept and support our own, we shall be able to win this battle.
It's another edition of Between the Lines, and today we are discussing home-based care for COVID-19 patients. And in studio today we have the County Health Promotion Officer, Madam Ellen Nguaren. Alongside her is Jen Josiah, the Programs Manager, Midriff Hurinet. Keep sending in your questions, your suggestions, and even comments, and we'll keep sampling them as we go on. Another question here is on PPEs. How are the members of the home-based care protecting themselves since the PPE equipment are limited?
Thank you so much. That's a good question. The PPE equipment are limited, but I would say for now we have enough for the healthcare providers, because the people who are needed to use the PPEs, especially the full gear, it is the healthcare providers who always are having an access to that person who is on home-based care. So we don't need the whole gear other than the PPE we are calling the mask. That is the one that we may need for the family members, and that is why I have mentioned that in case we have a scenario where this person has to be provided for food, they have an area where they go and put the food for this person. This person will come and pick the food, and if he will need to bring back the utensils, he will come and put these back utensils to that very point, and then there is sterilization of the place or fumigation of the place where this person is. And note, when we have put this person in that home-based care area, the moment this person will be well and will vacate that place, the Department of Health will have to come and fumigate that area fully to make it free now and viable to be used by the other people. So the PPEs, for now, we have enough for the healthcare providers. The masks are also there in the public, and at least the government has provided. The government is giving people free, and there are those that you need to buy possibly for 50 shillings also. So the PPEs is, for now, we have enough for the healthcare providers. And in fact, even those that are working in the private sectors, they have started going to get them, and we want to appreciate that in our county we have our own bedy that is making them. So they are there. They may be expensive, especially for the people who are buying for the private for the private sectors, but they need them. But the public people, they do not need the full gear of the PPEs. The only PPEs that we may need for the public is the mask and possibly the gloves for some procedures if you may need to do at your home, not any other. But for now, we appreciate that the government, we have enough. And in fact, throughout this week, we have started having, I don't know whether our CEC mentioned this, that we have had a few healthcare providers who have already been infected. And what we are doing, as the Department of Health is to refresh all the healthcare providers on the infection prevention measures. So we have had a few sittings where we are trying to train our own, just to refresh ourselves. Could we have forgotten the procedures or the precautions of infection prevention, so that all the healthcare providers cannot also be at risk? Because you realize if all the healthcare providers or many of them are infected, then there will be a more crisis. Because when the community comes and the healthcare providers, many of them are already at home. Because, for example, if I'm infected and I was working with a setup of 20 healthcare providers, they also need to go to quarantine. So about 20 of our healthcare providers are already out of work. So we shall have a crisis in the Department of Health. So I would say for now, we have enough PPEs, especially for the Department of Health, and for the community, what they need is simply the mask, and even possibly the gloves in case they need to do those procedures that may need the gloves, not the other full gear, because they may not even know how to put it on.
Jane?
Yeah, I would like to add that because we all know that the government procedures are, let me use this word, bureaucratic, procedural. Sometimes there are delays in disbursement of the same. As Midrift, we had a precaution to that, and we were able to acquire or actually procure some masks and actually personal sanitizers, which the community health volunteers can be able to use even as they go to the households, because we did not want to take the risk also of the gap that may be and have them who are the frontline actors infected with the same. So we are proud also, our partners also realize this and were able to support us to do that with the for the community health volunteers and the CHVs. We also do a lot of soap, because even soap is enough to wash the hands, and we've been able to distribute this even to the police, all the police stations actually in the entire of Nakuru West, Nakuru East and Naivasha, and also provide the gloves, as Madam Island says they're important, and also the masks, for all of them.
Well, I applaud the great efforts that the both organizations are doing. What have been the challenges that you've faced?
It's just challenges are always there, and this is about the behavior change that we are talking about. Sometimes even the frontline workers themselves, they may just put themselves at risk because they think that it is far. It is not, because we do not have actually cases of the same, and they would complain all the time that the community they are serving actually are ignoring them. That was the worst motivation, maybe the motivation that we had, because you have the community health volunteer goes to the households, goes to the community, sensitizes tries to pass the information to the community, but they get ignored, and this demoralizes them. Otherwise, for our implementation, we do not think we've had any challenge that can make our hamper maybe our delivery of the services that we needed to deliver, because we have had activities such as awareness creation, using the mounted speakers, and we shall continue doing the same, and they were very well received. Actually, we did it together with the county officers, and we did not encounter any challenge towards that. I think we have been okay with that. It's only now the community which needs to change their behavior, because they do not adhere or they do not take the measures to be very serious, and that is why we keep on going back to them over and over again. So for implementation, we may not have had a challenge, but the response is where we have a challenge.
I think it's the same thing.
In fact, the challenge is if the community is not coming on board, we may do a lot as the Department of Health together with the county government, but if the community doesn't come on board to hold hands with us so that we can be able to combat the disease, it's a challenge. And that is why we are calling on the community right now to embrace behavior change. Wash your hands regularly, wear the mask, keep the social distance wherever you are, and we shall be able to overcome the disease. Otherwise, that is the main challenge that we're having, because for awareness we have done a lot. The county government has tried to do the much that we can, and that is why we have trained even the community health volunteers to reach them light at home, because possibly they could have been feeling they are doing it in Nakuru town. What about Kuresoi North that is on the far end? What about Kuresoi South, which is in the far end? What about Kianda Sana in Subukia? We have trained our CHVs as far less from there, so that they can be able to reach out to the households. We have tried to venture all the strategies that we can use. So all that we are calling on our community, behavior change. Take it as per your own. Be responsible. Take responsibility to prevent yourself, to prevent your family, to prevent the community. And when all of us does that, we shall see our numbers going down. Right now, they're just going up. The trend is up. But if the community will embrace the same and take it as their own responsibility, we shall be there.
Salute to all the members who are watching us on our different platforms. I want to salute Calvin Muga, who has been watching, Otieno. We have Ngena Kenya, who has commented and said that great job to Midrift Urinet and the county government for a noble idea of trying to help the people, and also salute to Nakuru TV for amplifying what this is being done. Then we have another comment here, Estelle Mwai. This is a very timely discussion and we should have more of this. Simon Mwangi says, great discussion, keep it up. What is the last word you can tell the viewers out there?
I think my last word I would say, let us all join hearts, because we have tried to do a lot to create awareness. All that we need from our public is join hands, take responsibility, protect yourself, protect your family, protect the nation, protect your neighbor. When we do that, we shall be there. And let's look forward. Wash your hands regularly. Wear the mask and wear it in the right way. I think I should wear mine for those that are viewing. Wear it like this and wear it in the right way. This is the right way to wear the mask. Put it there, not this way. This one is very wrong. Not this way, very wrong. Wear your mask in the right way and remove it in the right way. And those that are using masks of this kind, discard it immediately that you use it. And the ones that are using the cloth-made masks, make sure you wash your mask daily. When you get home in the evening, wash it and then it will dry overnight so that you can be able to use it tomorrow. Zote tushikane mikono ili tukaweze kukomesha corona na tukaweze kuendelesha uchumi wa taifa letu. Asante.
One word maybe?
Not one word maybe, but I would echo what Madam Elena said. Yes. We are in it all together. COVID-19 is here with us. It's here to stay. And what I would say is that to the community, there's a lot of support that is available. You could be going through different adversities or different situations. You could be feeling worried. You could be having fears. You could have lost your job. This is not the end of everything. You could be in need also of food, or you could be in need of any other support. Kindly, mental health is very important for you to be able to continue in this life. And as Midrift, we are here and we can be able to help you navigate and look for a way of coming up with a solution to whichever problem that you are having. We have a lot of community health volunteers who have been trained and who are able to support you in, with your mental health issues or provide you with psychological support within the community. Kindly visit the nearest health facility if you are not able to identify one, and we shall give you the support you need. And if we cannot be able to give you that support, our procedure says that we can be able to refer you for services somewhere. We are here for the community. Yes.
Powerful words there. A salute to Andrew Muturi, who has been watching, Shiro Wagadura, and all the comments that have been coming in. It has been an amazing discussion, and we wish you the very best in all that you're doing.
Thank you.
It has been an edition, another edition of Between the Lines. I have been your host, Karanja Jackson. We have been discussing home-based care services for COVID-19 patients here in Nakuru and around the country. For all that took part in the discussion, and a special salute to Midriff Urinet for powering this discussion and this a noble cause. From here in studio, it is Kwaheri and stay safe.